Hi there. Welcome to this third part of the Playware technology series. Today we're going to talk about a little bit about how can you possibly become able to create the next billion-dollar industry within Playware and using some of these things from Playware. And you may remember last time we were talking about the history, the background of Playware from the physical games in the arcade stations over to the home use in Sony iToys and the Nintendo Wii and so forth. So we saw these different examples of, for instance, Lego Mindstorms, Nintendo Wii, Pokemon Go, and also talked about how some of my former students uh, did this travel from Playware, taking inspiration from user interactive devices and robots to create things like the Universal Robots company. And today we're then going to look a little more into this. How will you be able to engineer the next billion kroner Playware product? Because of course it's a big challenge, and there are many things to this. And here are just some of the steps that we can see from going from idea to market. And as you can see, there are so many of them that it almost looks impossible. This is actually from a real case, how they have gone through all these different steps in order to reach the market. But as I say, it does look really big and messy. So we'll try to see if we can put some order into this. And if we look at it in this way here, I've now put in a few numbers in on the left side. So these you can say are specific steps in this process. So first they did number one, then number two, number three, number four, and so forth. And what happens is that they are actually iterations, as you see on the drawing, that these are subsequent iterations where the idea and the prototype and the product becomes more and more refined through the ideas of the device they want to create, through a prototype, through implementation and testing, evaluation, and then redesign again. So you're going through a number of iterative cycles of this kind in order to go closer and closer towards something that you can put to market. So for instance, here we see that they first have an idea about basic concept, an idea, a rough prototype, and testing that can become into a prototype that they can then test and do some pilot testing for new application areas, then create a new prototype, test that again, adjust and refine that. At that point, start to look into production and how to make the production going well, then testing from the production and look at what is the promise in the market, and then maybe create a new design, create a new prototype, test that in the labs, and go and make the production again, get the certifications and patents and effect studies, and setting up sales and support and distribution and promotion and so forth. So it is a long journey, but fortunately we can fairly easy start up with steps number one and two, which you can even reach when you're an engineering student and start doing things that you're really motivated to do. So to summarize what we looked at in a little bit of messy form before with that particular example, we can put that into a model, into this kind of iterative model, where you can see on the left that there is some initial planning, some initial idea that you plan for. You look into what are the requirements, you do an analysis, you do a design, implement, and then you deploy, for instance, in a test. So you test that and you evaluate, and then you come back to again, and you can redesign and re-implement, and you can go around in this this circle here. And then at some point, you can also go down and you can spin out, as you see on the lower right of that circular iterative model, that you can then spin it out at some point. This kind of iterative model you may know from software development if you have tried to do Scrum sprints, which in a sense is very similar to that as when we're doing the physical products that we're talking about here. In terms of the software, when you're doing Scrum, it's also that you are going through this cycle where you discover, you design, you develop, and you test. And then you go into a new cycle where you use that to discover, design, develop, and test, and a new cycle again. So remember, we're doing an iterative model. So little by little, we're refining. We're saying that from the beginning, we do not have the predefined solution. We have some ideas, and then we very quickly start to implement them. We do some kind of fast prototyping. So that's important that you can, if you can do fast prototyping, then you can much faster come into doing some testing with real users in real environments. And then based on that, you can evaluate how did this go? And then you can do redesign and fast prototyping again to create your new iteration of the prototype, test again with real users, evaluate, and then come back to, and maybe again refine your prototype, create a new prototype, implement, test, and evaluate. So that's very important, and we have seen that in so many different developments that this way allows you to much easier get a grasp for what is it that the users would like to have. Because it's not really any good if you're just developing a nice engineering solution, but you impose maybe a lot of your nice engineering thoughts in that. But let's say people outside the engineering domain, they may not understand our engineering way of thinking. So if you have not tested that well with the users, you may be thinking that they can understand much more of a way of interacting than they actually do, because they are not engineers. They are not thinking directly in the same manner as we are doing as engineers. So it's so important that we go out quickly and test with the real users of our product, which is supposed to happen in this kind of iterative model. And this is in contrast to what I put here, in contrast to what we can term the waterfall model, which is the traditional one that you have probably used in a number of engineering projects, where it's very natural, and it's very compelling to think that we can do as the water model says, but here we're showing that actually you need to use the iterative model. But the waterfall model is quite attractive, because you think you can give the requirements to your product, and then you just design, implement, verify, and then put it out there, and you maintain. So what you have decided from the beginning in terms of requirements is what you are then doing, and you implement this. You make your product and you put that product out in the market, and that's it. There's no iteration. There's no way of changing. If you imagine your requirements were wrong, what happens then? You get a product that's wrong for the market. What happens if in the process you discover that there are some small errors? Well, you cannot repair those. Then you need to go back and repair the requirements, and then essentially you're back into the iterative model where you're circling around, and you're allowed to go back and change. So the important thing here is that in many situations, especially when we are talking about interactive products, when we're talking about human machine interaction, human robot interaction, products that are supposed to be used by real users, everyday people, then it can be very, very difficult to make those requirements that are needed in the waterfall model. Can you imagine this? Can you, from the beginning, before ever putting this out to test with people, can you imagine every single way that they will interact with your product? Probably not. I'm quite sure that you cannot. And that means that the waterfall model, it becomes very difficult to use, or essentially impossible to use, because from the beginning, a priori, before you get started, you cannot put up every single requirement which is needed in terms of the many different stupid ways that people will interact with your future product. So that means that you do need to go into a cycle, into an iterative model where you little by little are able to refine what you're doing. So let me take the example here. If we want to create Playware, you remember we talked about creating technology for anybody, anywhere, anytime, by building bodies and brains, the combination of hardware and software, which facilitates that people can see, construct, combine, and create. So now in this case, if we want to create technology for anybody, then it's of course difficult to imagine what they would how they would like to interact with your product. So you probably need this kind of iterative model. And the example I will take here is based on, we want to create something that can adapt to all these people who have different physical abilities, different cognitive abilities. They may be raised up in different cultures. They may have different ages and so forth. So the idea for this one here is that we want to create some modular Playware that can adapt to people, their different use. For instance, in health, in terms of different treatment areas, activities, patient levels, patients' fatigue, and so forth, utilizing the modularity to allow for flexibility, ease of use, that it can be used anywhere, and to create some robustness. So instead of creating, as on the left side, one fixed setup, we use the modularity, as you see on the right side, to create flexibility where you can lay out this, in this case, tiles. You can lay those out in different patterns. You can lay them out anywhere. So you get a flexibility, not a fixed setup as we have on the left side, which you can also do, but then that needs a certain infrastructure. But instead we do as on the right side, we create modules that allow you to freely construct, combine, and create as you like. So instead of a fixed setup, we have this more flexible setup. Again, you can see here an many different kind of games in using different colors. The girl who she's playing Simon success gained, she has to remember the sequence that is being shown. It's more complex and challenging. As the physical on the right side, you can see that they have changed the physical layout to explain the different types of different So I want to take you through a little bit of this way of circling around in developing products. So you get an example here of that, and I will take the example with these modular tiles that you just saw, and start to go back in time. That actually started in a collaboration with Campaign. Campaign is Europe's largest producer of playgrounds. Maybe they're even the largest in the world. They have a 2.2 billion Danish kroner annual revenue. So they're making all these kind of playgrounds that you see out in the parks, and also a lot of places indoor. And they came to us at some point and said, now these are quite nice that we have this big market share, but nowadays we see that less and less young people are coming to the playgrounds. They're more inside, they're playing with their digital tools. Can we imagine bringing some excitement out to the playgrounds again with some of this electronic digital tools that you're working with? So we started to brainstorm together about this, and came up with the first idea, and was to do something about the ground floor under a playground, because that's normally not used very much. So we said, couldn't we make that interactive? And came up with the first kind of prototypes. Looked like the black ones you see here, tiles where there is a dot where you can press, one that goes a little bit up where you press, and then there's another one, there's the small one where you can see the light will come out, the colored light will come out from there. On the right side you can see the sandwich, how it's created. There are these two underneath, there's these two plates. In the middle there's the electronics. There's a force sensitive resistor going up, and then there's the rubber cover on top of that to make it very robust and sturdy to be outside in the playground. It's connected to the neighbors with wires, so each of it has 4 wires coming out which can connect to the neighbors of this tile. So it's flexible to be put out by the installation guy can put it out, but you cannot really move it around yourself in the playground. Another example we came to in creating prototypes was like in this image here, that we put out sensors and actuators on different parts of an existing playground, namely places where you can run to push buttons, and places that have speakers and have colored light coming out. And then somewhere there would be an interaction station, which would be a touch screen, an outdoor touch screen, where you could then or the boys and the girls, they could draw a path that the other ones should follow. So that sounded like quite a nice idea, that you can draw up different ways that the other children have to follow, and they have to run around and climb and press the buttons the right places when the sound is going on. So we implemented that and tested that in a school, and found that yes, in principle this worked, but it had some flaws, and one of them was quite important in the interaction. which we hadn't thought about before. Namely that when the children would come out on the playground, they would have their break in the school for maybe 10, 15 minutes. Now, if they come out to this new playground, they would have to go and draw this path, and then some child would follow that path and run over and touch one place, and it would give a sound another where she would have to climb over to the other place and touch there and so forth. But as you can hear, this would be one child running around. So during a break, there would be maybe one drawing this path, one child is running around testing it, and then the first child would maybe also have time to go around and test it, and then the break would be over. That would mean that during a break, maybe only 2 or 3 children could play on the playground, and then a playground doesn't work. A playground is good when there's many children around playing together, social play, and they are interacting with each other. So it turned out that testing out in reality gave us a knowledge that the interaction patterns would not really give us a good product. So we had to do something else. So we looked into different things in terms of a design strategy, as you can see here. Going from left to right, we are going from 2 dimension over 2.5 dimension to 3 dimensions was the idea, to go first on the ground floor, then the ground floor plus something sticking up from the ground floor, and then over in the future to have something totally free, big boxes that you can maybe move around or so. But we started out from the left with the 2D floor. And the very first prototype looked like this. And as you can see, this is something we did quickly in the lab just to test it out. So we had made the electronics, we put it into some material that could be used to step on, and then we took this out to the children outdoors and indoors to test it out, what happened when they jumped around this. As you can see, they had 9 dots of light they could light up to begin with, just in 2 different colors, just to test that red and blue, and when they touched it, it would toggle from red to blue or blue to red. So just to get an idea about how could this thing work, to have a fast prototype, as we talked about. This is important, that we can quickly make a prototype, come out and test it with the users, get the knowledge about how users interact with it, and then use that, evaluate that, and then do redesign to refine prototypes. But even having made this, what we can do is in this iterative circular model, as you remember, there's one place where you can spin out things, which actually happened here, that we were collaborating also with Danfoss. They were making what is now known as the Danfoss Universe, a theme park for natural science experimentation and stuff like that. So they wanted to use this, so they made a spin out from this, made this in a more industrialized version, you can say, that could be used outdoor in a theme park, just as it was at that point. So even if we're saying we're going around in this circle maybe 7, 8 times, they could even around the second time around, they could say, okay, now we spin out something from there. So having gone around 2 times, they could spin out something that they could use in daily use. But we went on from there in new iterations and created this tiles that I talked about just before, and we could bring this out to testing then, which you can see here in a kindergarten, how they start when we give this out to them. Here you can see that there are quite many of these tiles. Each tile has just one light. We put them out on the ground. The children start to explore. Maybe hear the soundscape that they create as well. So this is typical. of the way that they explore, and then little by little they start doing other things like sports performances like this. They would start going into using this as a kind of performance floor to show different kind of physical movements to each other from using the soundscape and the interactive floor, and then make this into performance, real performances using this as a stage. So here you can see the Playware is pushing them into a playful state of being. The Playware acts as a mediator. Now it's just a stage, but it mediates them into doing some specific play with each other. But what we could also do with this, having this go further into making prototypes, here we refine the software and create adaptive games. This game is a box puzzle. She has to smash those 3 boxes that comes up. And then little by little, what we do here underneath, we have a neural network that recognizes the behavior that she has, and then little by little starts to spread this box further away from her. As you can see here, after a while, then the box will start to appear further out in the corners, further away from her, so she has to move further away. So we're enforcing her to have more physical activity. So we can make the games adaptive like this, which we will return to in a later video during the course here. But Campaign could also then make, at that point, when we had explored for a number of rounds, they could also take some ideas out to use as a product, in this case the icon product, where we took the ideas we had explored with having these things that you can interact with up on the playground. So they created the icon product like this, which is now sold on the world market. So even if we are going further around in the cycle, which we will see later on, they at some point here could spin out a product that they could use on the world market. And as you can see, they're trying to use this to activate the children, to get them more physical active out in the outdoor space. So let me go on further here. So because then we go on in the circle here. So we create the third and even the fourth prototype series, as you can see on the image here, and testing this in other use areas, like in the hospital here with the physiotherapist playing a game, trying to catch the color there, but then he can layer up in another physical layout structure like that with a cardiac patient. So when he explores creating physical different topologies, how does that change the interaction by the patients? He can even do it on the bottom with a stroke patient. Here the stroke patient is partly paralyzed in the left side, so he has difficulties moving his left arm. So when he used the left arm, you can see he needs to support it. This is really difficult, reaching all the way out there. Oh, it's difficult. But he's doing those extra 10% because it is a play, it's a game. Again, it's difficult for him now, but he wants to progress in the game. So he's excited about playing the game. He wants to have a higher score. So we can explore all those things with the further prototypes that we're creating here to see how the user also, so there's the operator, the physiotherapist here, is changing the physical layout, how he can use that to make the system fit to this particular patient. So,
it's with the balance, it's a little, it could be a problem.
And then also being so long in it, now we are talking about the fourth cycle or the fifth cycle here, we are able to go in and do clinical tests. So some of the first clinical tests, there will be many more in the future, and I think we'll also return to how it's a good way to test Playware products, both qualitative and quantitative tests. But here, just to show you a simple one, during this development process, you can also then go in and do tests to look at, for instance, here, patients for 3 months playing with the prototype. What can we measure there? Here we measured, because it was for cardiac patients, what is how do different games push them into having higher and higher maximum heart rate, and why is how are they evaluating this to be good or bad for them, and even have this reported in the international media, as you can see here. And then look at different ways of interacting. For instance, for when we're creating prototypes, we can of course introduce different things and test those different things out. We didn't know what would be the best way to, for instance, select between the different games. So one thing that we tested out was a master tile, as on the left side, where you would down on the tile with a small display, you would have to toggle through different games and different settings. Another one we tested as on the right side, having iconic cards that are RFID cards that you swipe and you start the game. Or we would do things with radio communication from a computer that could then where you could select games and levels and so forth. So that's again the thing with creating prototypes. You can easily test out different design and test different options if you don't know beforehand what is the best for your particular users. And we did see differences between when we are testing in hospitals and in kindergartens and schools. They may want to have different things and that they can use. And here, for instance, using this here, you can see selecting the games on the master tile on there, and bringing this into a private home for therapy of a stroke patient. This is quite some time after the stroke, and he has been the patient has been going to the hospital, but now he's in his private home, and then they are doing the rehabilitation in the private home with him. He still has some balancing issues that he needs to train for. Again, bringing technology to anybody, anywhere, anytime. Of course, here today, the important thing here is that we are in these cycles, we're testing out different options here that gives us further and further knowledge on how such a product can be best possible designed to meet those different kind of uses that we don't know so much about beforehand. Also, for instance, bringing them into hospitals, like here into children's hospital, testing in children's hospital, how they can interact with it in a different manner, put them up as a wall, and maybe steering them with another interaction modality, namely a small cube, that when they turn the cube, they select different colors, or they're shaking out the patterns. You can see this child cannot move to touch the tiles, but then he can have this other object be designed in his hands, and when he turns this, turning out different patterns. When he's shaking out sound, as you may hear a while.
Of the cubes can control?
Yeah, well, you can this holes on the side.
Right.
So we tested many different with many different users. Even we could test with Her Majesty the Queen in a municipality rehabilitation, as you can see here. Or like here, testing what kind of feedback is needed. So in terms of the software, what kind of games do we need to develop in order to create motivation for the users? So that brings us on to the fifth prototype that we made for production to bring out to the market. Even if you'll see later on, we'll have even further cycles. But you can say to test in a pre-market, so to speak. So this one was created with inside force-sensitive resistors and accelerometer inside. As output, there was colored light and sound. The processor was an Atmega 128. There were polymer lithium batteries, and the communication here was wireless. So the neighbors would communicate. The tiles would communicate to their four neighbors when connected together. You can see they connect as this kind of puzzle pattern on the left side here. Left image, you can see that. But when they connect, then they communicate up to north, south, east, and west with infrared. And then the games was selected as on the right side with this kind of tags, iconic card tags. And we would have to go through the process of getting the patent. At that point, we had the US patent, and then later we would get granted the European and Asian patent, have the product CE certified so it could be used out in the market. So there's a challenge here when creating this to be used in reality, namely that how can we, for instance, calibrate this force-sensitive resistor to get reliable readings? This is not just putting in a sensor. Even if the sensor is the same type, of course, that we buy for all these tiles. Say we wanted to produce 1,000 tiles, we buy 1,000 force-sensitive resistors. Or you go down to the workshop and you pick those sensors. You believe that they behave in the same way, but it turns out they behave differently, one from each other. There are different sensor characteristics that influences on that. But apart from that, there's also things like the mechanical design. Imagine here, people have to press down on the tile. When they press down on the tile, we want to get a sensory reading of that. How much force do they push with? So if they push with a certain force, we would like to read a certain number, let's say 120, we read that when they're pushing down. Now, take another tile, you do this, press with the same force. We would like to, again, to read exactly 120, right? And the third tile, press with the same force. We would again like to read exactly 120, but we do not. And why do we not do that? Sometimes we may read 125, sometimes 117, and so forth. Why are there these differences? Well, the sensors may be slightly different from each other. There's the mechanical design, whether they're designed, whether they're produced exactly the same. The material may have different properties. You know, on top we have this lid that is bending down when you're pressing it. It's bending down to press down on the sensor. Is that bending of that material, is that the same for all 1,000 tiles that we're producing? Probably it's not. And then there's the production method. Is that reliable? And I said the mechanical design, you see on the image around the electronics on top of this blue PVC, there's this O-ring, the white ring going around that gives some kind of flexibility, some spring quality. Also around the sensor, you see we have this kind of double tape around the sensor, so that's also flexible, giving some spring quality. On the right side, you can see the next prototype round. We don't have that same kind of O-ring that's inside the plastic now, part of the plastic, and the same is around where the sensor is going to be positioned. That's also molded into the plastic to get it more reliable. So in order to get the spring quality to be equal in all of the tiles, to go further and further towards that, we always read 120, as our example was before, plus minus a small variation, but we want that variation to be very small. So that's of course a challenge that you have to think about when you're creating your product. It's not just making the hardware and then the software, because when you're making your hardware, this is a mix, the reliability is a mix between all these factors that you have to take care of. And again, that's why it's good that you use this kind of iterative circular development model, because these things, I'm sure you wouldn't think of those if you are using the waterfall model, where you initially just make all the requirements and you implement this and you put it out. And you would not catch all these small differences that you will see, and all these differences with the users, but also in the production method, as you see here. So we created now this one here with, as I said, the pressure sensor, the batteries, the LEDs, and so forth, became the next prototype round that looked like this, with the patent, the CE certification, and so forth, and then started to bring this out to hospitals, especially, but also others, looking at how the therapist could easily set this up within 1 minute to make the system automatically detect the structure that was built and then adjust the levels to the different patients. But also when creating things like this, you have to think about, you also need to, obviously, to make it so simple that anybody can understand this. So we said this needs to be understood in these 3 or 4 simple points. Turn on the tiles, put the tiles together, swipe a game card, and then play the game. And then number 5, after you have played many games, you can put it into a charging station. So this is also important. How do we make this so easy that it can be used for in the Playware ABC for anybody, anywhere, anytime? So this is also part of your development of your product, that you have to keep this in mind. How do you make this easy for any user to use? Give them the instruction, like here also on the different games, to easily understand playing these games. And then having that, we can bring it to many places, like on the right side in rehab in Africa, in the middle of the parallel walking bar, or in Japan, in collaboration with Professor Sankai, looking at his HAL exoskeleton. But when you have to use the first one developing exoskeletons, and it's very impressive skeletons that he has developed, like this one here, to make people who cannot walk again. But when they have to learn using this kind of exoskeletons, they would have to go through training cycles, many times of training how to use this. And we give them the motor tiles to make this a fun and motivating process of learning how to use the exoskeleton. But again, the importance here is that we can put this up in many different configurations. As here on the left side, the child there can only reach out to use 4 tiles, so the therapist is just putting up 4 tiles, whereas on the right side, she can move a little more, so she gets 6 tiles to move with. And you see, oh, she wants to reach out there, reach that one here, and she really would like to continue in the game despite of her difficulties. And she goes out and she makes all those movements that are good for her rehabilitation. And you see on the right side, they can then push this up next to the parallel walking bar, and the child can then by herself play the game without support, direct support from the therapist. She wants to reach out there, and she's actually finally able to do so. Yeah. So as you can see here, we're going through, just to repeat, going through this iterative model every time, looking at design, implementation, deployed out in different tests, and then we evaluate on this test. Based on this test, we get ideas for the next prototype round. How should that, what are the requirements for the next round? How do we design that, implement that in a new prototype, put it out in real life testing, evaluate on that, and go back and do the next round of prototypes. Even if it's tedious, you can see here how it helps us go one step at a time, one cycle at a time, to get more and more knowledge about this. So here at this point, we will go down and look at, now we reach a point where we have so much good knowledge about this, we would like to deploy this for real. So we take the error out of this cycle now, where we make the spin out to a product. So when we want to create this as a product, what we said, with all this knowledge from all the prototypes, what would we design now? So our design philosophy is and was here that we wanted to make this simple for everybody. So we take the inspiration from people like Leonardo da Vinci, said it very, very nicely. Simplicity is the ultimate sophistication. Often it's even more difficult to make things simple than to make them complex. And then you even probably know it from your own engineering studies, from different exercises, project that you're given in different courses. You may always think that if I make this very much more complex, then probably the professor will think I'm very, very smart. But often it's actually the opposite. If you can make it's simple and clean, then that is the smart thing to do. And it's not overcomplicating things. We always tend to think that if we do things that are complicated, then people will look at us as smart and intelligent. Whereas, at least if we're talking about creating things that we want to give people in their hands to work with, then simplicity is much, much better. And therefore, remember this quote from Leonardo da Vinci: simplicity is the ultimate sophistication. And we also have others, like the famous chef Gio Ono said, ultimate simplicity leads to purity. And Gandhi, of course, also talking about simplicity. So we tried to use that to create this tiles we call the Moto tiles. We got together with the design group at the famous Henning Larsen architects. You may know the Henning Larsen architects from things like they designed the Opera House in Copenhagen and the Foreign Ministry in Riyadh and so forth. They made this very nice. It's based on Scandinavian functional design. So we took the same kind of idea about minimal functionality as a design here. And as you can see, here are the tiles nicely put into the charging station with the design from Henning Larsen Architects, so that you can easily carry this around. As you can see, if you are a care worker, you can put them on your bicycle, and you can go in on your bike ride to the next house and take them out and set them up. So you can actually set them up within less than a minute. And here we'll look at how it's being used in Denmark. This is short, 4 or 5 minutes.
Denmark
video.
is the world's happiest nation, according to the World Happiness Index. Now, a new Danish invention is improving the quality of life for old people more than ever before.
Yeah, sometimes on Wednesdays we would say, I really don't feel like it, but we ended up going each time.
We know that many elderly people have falls, and often they can hurt themselves so much that they end up in hospital. That's why it's important that they train the muscles in their legs to help their balance. One of the ways to help and support this process is by training them using these specially developed electronic floor tiles.
Bente, there will be fewer and fewer dots, so you have to keep them going.
Yes.
You have to step on every one.
Yes, I'm trying. trying.
Our patients are very happy to train using the tiles. They're playing really, not training, so they actually forget that they're in rehabilitation. They help each other and do the exercises together, so it becomes a game and it's fun for them to be here.
We laugh a lot and we're having fun.
Yes.
I really think it is fun.
While working on my PhD, I've been studying balance training on the tiles, and I've seen how much the elderly enjoy working with them. It's helped them to move a lot more than they usually do. Their balance has improved by 150%, and they can now manage many more everyday things on their own.
I used to be completely paralyzed, but now my body is working properly again.
Yes, that's amazing.
Do you remember when you saw me in the home, when I just laid flat all the time? I had to be lifted up for everything. I couldn't do anything on my own.
Yes, I remember that.
They looked at me so worried, the other patients, but I couldn't do anything.
Yes, that's right. Don't you remember I said I saw you?
I didn't see what was around me much because I was in a whole other world.
You were. My back is now 10 times better since I started with the tiles.
Yes, and now I can straighten my back in a completely different way, especially when I'm walking my dog out on the footpath.
Yes, now you can stand up straight.
Yes, I can, right?
After just a couple of days of training on the tiles, we can see results. They have much more confidence and are able to do a lot more on their own. They let go of their canes and frames and can walk on their own.
They forget that they're exercising because they're playing a game, and that's essential if their balance training is to be successful.
As a professor of the Technical University of Denmark's Center of Playware, I'm really pleased to see that we have reached a milestone with the tiles. We have shown major benefits for the elderly on their balance, their strength, and also their motivation to come here to train and play. We have spent 10 years creating different prototypes of these tiles, and they now have a remarkable effect on these old people. They have really improved their lives. It's great to watch such progress.
Sometimes I get a bit jealous because you're so fast on the tiles.
Oh, so you think so?
Yes, you're very fast.
Well, I have my good days, you know that. We always have some good days.
Yes, we do.
If the challenges of the elderly are going to be solved in the future, I think we need to look at alternative methods than have been used traditionally. One of the solutions is to work with new technology, particularly this kind of therapy, which can be offered using devices like these tiles.
For Christmas, I wouldn't mind getting myself a set of tiles for home.
Okay, so hopefully this gave you a good idea on how the motor tiles are being used in society. In this case, in Denmark, and now it's being used the same way around the globe to help, for instance, the seniors who have balancing problems and who may be using cane and walkers to very fast be able to get so good balancing skills that they can throw away the canes and their walkers and walk by themselves, do things by themselves in their daily life. So it actually has an impact on people's, a very direct impact on people's lives. And you could see how we have gone through this many cycles to reach this goal of creating a technology according to the Playware ABC that can be used by anybody, anywhere, anytime, by building bodies and brains. And it allows people with the tiles, as you can see, to construct, combine, and create the ways that they want to interact with this. And as you could hear during this time today, that we have gone through this even from the very first prototypes, those that we were making very quickly in the lab, and tested those out in the school with children, and then we made the playgrounds that we could test, and then we went into with a prototype to the hospital to test, and we could refine that and make some early effect studies on those, and see the promise in the market, and then create a new design, and then at some point say that we want to spin this out, go together with designers, and have this made in a proper production manner, and then now being able to distribute and promote this. So so you can see this was all possible to reach this now, where this is being used around the globe for seniors, and really helping people in their retaining and regaining their skills all around the globe through this iterative model, through this getting further and further knowledge and refining the product. And we could not have done that from the very beginning, set the requirements to do that, and then just implement those and put that out in the world. So please remember that also for all your other engineering projects that you may have, that often this is a very good model to use, that you make fast and iterative prototype development. And I remember, just to give you this, I remember in our projects together with Lego, they always tell us this very nice thing when they're looking at this. They're saying this thing, what we are doing is we are fast failing forward. So we are fast creating prototypes, then we test those, and probably we fail, but by failing we learn something new, and then we take a new iteration. So fast failing forward is a quite nice saying in this, because we cannot know everything from the beginning. So please remember this in all your different challenges and projects and tasks that you will have in both in your study and also in your future work life. That this is a very good model to use. So with this we will end for today, and thank you again for listening in.